pregnant women asking me if they should collect their colostrum before the baby's born to give it to the baby at birth. And I wanted to talk about, because I think it's really odd that so many people are asking me about it. So it must be on social media. So I just wanted you to hear from Dr. Scherbel what I think about that. Number one is most women are not making colostrum. So to be clear, colostrum is the first milk that we make when a baby's born. Most women are not making any colostrum at all until the baby is born. So if you're pregnant, you shouldn't necessarily anticipate that there is colostrum coming out. It can occur a couple days before the baby's born, but that is not typical. Typically, there is nothing happening with your nipples until this baby comes out. And if there was colostrum coming out and you wanted to collect it, that would be fine, but I wouldn't go out of my way to try to do that. And here's the reason. Colostrum is not milk. It is distinct from milk. Colostrum is a substance that all mammals make. It is created at the time of birth, at the first contact with the baby in the first couple days of the baby's life. And it's particularly a nutrient-rich fluid that has sugars, proteins, white blood cells, immune factors, and it is distinct from milk. Milk is separate. It comes in about 72 hours after birth. I'm always talking to women about it because they get nervous that their milk hasn't come in, and kind of like on the third or fourth day of life, of the baby's life, a mom will wake up with these really engorged breasts, and that's their milk. That's called lactogenesis in the second stage. But colostrum is this very specifically nutrient-rich fluid that is made at the time of birth to sustain the baby for the first couple days of life while we're waiting for the milk to come in. In fact, having the baby suckle and excreting the colostrum out helps us make our milk. So I just want to say, when patients ask me, I always say, well, it's not something I would go out of my way to do. I would not go out of my way to pump and try to collect colostrum, because I personally want the colostrum there at the time of birth, because that's when the baby needs it. It's got all the immune factors the baby needs. It's got a lot of protein and sugar that the baby needs at birth. So I'd rather have the baby have colostrum at birth than thin milk. So I wouldn't try really hard to stimulate my breasts or nipples and pump colostrum. Now, if you happen to be secreting it anyway, I guess you could go ahead and collect it. It would be good to give the baby, but I wouldn't make a big effort to do that.